Welcome to This Explainer. Today, we're diving headfirst into a really gripping medical mystery, inspired by the classic show House MD. But we aren't just here to talk about TV fiction. We're actually going to use this famous storyline to unpack a terrifying real-world clinical lesson. We'll walk step by step through the exact deductive process a medical team goes through when a patient is rapidly crashing. And as you'll see, it is startlingly easy to completely miss the true culprit when the clues seem to point in a dozen different directions at once.
Okay, let's just jump right into the scenario. Picture this. Our patient is Brandon. He's a completely healthy college student who suddenly collapses during sex. This isn't some gradual weeks-long decline. It's an immediate, catastrophic event. Within just hours of hitting the ER, his condition completely spiraled out of control. It forces his medical team to ask one absolutely vital question. Are they hunting one massive systemic killer? Or are they dealing with several completely different diseases striking him at the exact same time?
So, Brandon arrives presenting with this totally disjointed list of symptoms. He's got severe hypotension, meaning his blood pressure has tanked dangerously low. He's got a fever, a chronic cough, intense abdominal pain, a spreading rash, and nausea. The medical team immediately realizes something is highly unusual here, because literally none of these symptoms cleanly fit into one single obvious diagnosis. I mean, think about it. A cough points to the lungs, a rash points to the skin, abdominal pain points to the gut. It's like a giant jigsaw puzzle, but the pieces belong to completely different pictures.
That brings us to Section 1, the initial suspects, as the team begins hunting the killer to figure out what exactly is attacking this young man. Let's map out the team's deductive logic here, weighing the evidence for and against each potential suspect. First up, sepsis. It perfectly fits his fever, his low blood pressure, and just how generally toxic he looks. But the catch, there is absolutely zero clear infectious source and his lab cultures are completely blank. Okay, next they look at hypothyroidism. That would explain the severe fatigue and low blood pressure, right? But it totally fails to explain his fever or the sheer speed of his collapse. They even toss around the idea of a simple sinus infection because of his chronic cough, but let's be real, a sinus infection is just way too mild to explain a healthy college kid going into shock.
Moving down the suspect list, the team considers an autoimmune disease. Now, this strongly fits the sudden rash and the fact that multiple body systems are involved. But the evidence against it is pretty strong. The acute lab findings just don't match, and the disease is progressing way too fast for that. Finally, they look into endocarditis, which is an infection of the heart's inner lining. That would explain the fever and maybe some blood clots. But once again, they hit a total brick wall. It's completely ruled out by negative blood cultures and a perfectly normal ultrasound of his heart. Every single prime suspect is a dead end.
Section 2. A deadly twist. Just as the doctors are running completely out of options, the situation suddenly takes a rapid, terrifying turn.
Brandon's condition doesn't just get a little worse, his white blood cell count completely crashes. His body's primary defense system entirely shuts down. He is now severely immunocompromised and requires immediate protective isolation. The stakes are suddenly life and death, because in this incredibly fragile state, even a tiny viral infection, like a common cold, could literally kill him on the spot.
The team has to totally pivot. They now have to look for causes of profound leukopenia, this massive, sudden drop in white blood cells. The new suspect list includes some really terrifying options: bone marrow failure, leukemia, severe viral infections, drug toxicity, or toxin exposure. But guess what? The medical team is right back where they started. Even on this new list, each of these possibilities only explains a tiny fraction of the puzzle. Nothing ties the cough, the rash, the collapsed blood pressure, and the destroyed immune system all together.
This leads us to Section 3, the pharmacy mix-up, which gives us a brilliant breakthrough that completely shifts the perspective of the entire investigation.
Dr. House steps back and catches a timeline detail that literally everyone else missed. Brandon's illness actually began with something super minor, a simple cough. Everything else, the rash, the fever, the crashing blood pressure, developed afterward. This prompts House to ask a massive, pivotal question. What if the cough wasn't the disease? What if the treatment was? In one single sentence, the whole investigation shifts from hunting a natural disease to hunting a medication error.
And this brilliantly illustrates our real culprit. You see, everyone just assumed the pharmacy dispensed the correct pills, but Brandon never actually got his prescribed cough medicine. Instead, he accidentally received colchicine, which is a really potent medication normally used to treat gout. Why did Brandon and his doctors miss this? Because both medications looked almost identical. No one even thought to question the prescription until House decided to look beyond obvious medical diseases and investigate the treatment itself.
When we look at the clinical profile of a colchicine overdose, the terrifying reality of Brandon's condition suddenly snaps into crystal clear focus. Colchicine poisoning causes severe gastrointestinal symptoms. Boom! That explains the nausea and abdominal pain. It causes massive bone marrow suppression, which perfectly explains the profound leukopenia and crashing white blood cell count. And it ultimately leads to shock and multi-organ failure, explaining his severe hypotension and rapid deterioration.
Suddenly, every single one of Brandon's weird, disjointed symptoms fits into one perfect explanation, bringing us to Section 4, Occam's razor.
You've probably heard of Occam's razor. It's the philosophical principle that the simplest explanation is usually the correct one. Throughout this entire case, the team was bending over backwards, trying to force incredibly rare diseases or even multiple concurrent diseases to fit a really bizarre set of symptoms. But Occam's razor reminds us that one single, accidental wrong pill is a much, much simpler explanation than 5 rare diseases ravaging a completely healthy college kid all at the exact same time.
Let's officially close the case on our initial suspects just to see how this builds our final conclusion. Sepsis was out because there was never a convincing infectious source. Hypothyroidism was dropped because it just doesn't cause profound leukopenia or multi-organ failure. Autoimmune disease and endocarditis failed because the lab evidence simply wasn't there. And finally, leukemia was ruled out because the bone marrow suppression Brandon experienced wasn't malignant at all. It was entirely drug-induced.
Taking this back to the real world, the clinical pearls you should take away from this explainer are absolutely huge for anyone interested in healthcare or problem solving. Number 1, always review a patient's medications, especially recently started drugs. Number 2, drug toxicity can perfectly mimic severe systemic illness. Number 3, when symptoms don't logically fit together, you have to reconsider the timeline of events. And number 4, simple medication errors are often way more common than the super rare diseases we tend to fear. Sometimes the simplest explanation isn't a rare disease at all. It's just that someone, somewhere, made a mistake.
So I'll leave you with this final thought as we wrap up our analysis. Occam's razor is an incredibly powerful tool for making sense of complex, chaotic problems, whether you're in an emergency room or just navigating daily life. But it only works if you've made sure to verify the absolute basics first. If a simple pharmacy mix-up can perfectly mimic a rare multi-system disease, it begs a pretty important question. In your own complex problem solving, are you verifying the foundational facts before you blindly trust the simplest explanation? Thank you for exploring this fascinating medical mystery with me, and I really hope it changes the way you look at the clues right in front of you.